Real quick, Roger, News 19. My question is, with the partnerships that you guys have been so good about creating, does that include anything with police, rescue, fire, where they seem to deal with a lot of the homeless, mental health issues on the streets versus a family bringing them in? How's that relationship go, and what, if you can, a percentage of beds for those people that are kind of
I'm going to
homeless?
let Josh take that one since he deals with the operational side.
Sure, absolutely. So those partnerships with local organizations and police, I think, is critical to the care of our patients. Sometimes patients just find us and walk into the emergency room. Sometimes they're brought to us. But we know that opening these 4 additional beds means that we have a place for them locally where we can take care of them. And so that communication, that work with law enforcement and others in the community and our county health workers and everything is even better because we can take care of people here in the community.
I guess if these new beds end up being a big success with you guys helping within the mental health services, do you plan on adding more to any other Gundersen facilities in the area?
Yeah, what I'll tell you to the answer is to that, we are continually just evolving and exploring and innovating our care delivery model for behavioral health. So I'm not going to give any surprises away, but there's a lot of exciting news coming in the future.
You mentioned that the closure of the hospital in Eau Claire had an impact on the hospital here. Can you elaborate a little bit on the impact that had?
Yeah, so when you think about the need for inpatient behavioral health beds, we know across the country, including Wisconsin, that there is not, the supply versus demand is an issue. So many times patients have to travel. So we had patients that came from their region to our area. We had patients that when we were full had to go to other regions. So it's just a lack of inpatient behavioral beds across the state that really is compounding the problem. So we're just going to be part of the solution to that.
Is there a number of maybe supply and demand like in the region that we would need to meet expectations of the community?
I don't even think we could predict what that number would be. We could probably commit our entire 325 bed hospital to behavioral health needs. Unfortunately, it is really difficult to do that today.
I might have to add addition.
Yeah, please.
So I think what we're lucky to have at Gundersen is a full spectrum of care from outpatient to our acute mental health beds. And so we want to continue to grow that and understand where those gaps are. And like Heather had mentioned, we continue to look for opportunities, and we feel there's probably some more opportunities in the future. That may not mean that we need additional inpatient beds, but we need some higher levels of care that we've been working